Welcome, listeners. I'm super grateful to have Sydney with me today. Sydney, thank you for taking the time.
You're welcome. Yes, I'm happy to be here.
I'm really happy you're here too. Let's go back and hear about how you met your husband and how old you are, where you live, all of those things.
Okay, so we are from Houston, Texas area, a little south. I'm 29. Me and my husband have been together 12 years, married 6. So we got together at the end of our high school, so high school sweethearts.
Oh my gosh, that's so fun. 12 years is a long time.
A very long time.
I
And
imagine you've experienced so many things together.
yes, you kind of grow up together. So you go through all the little things and big things, and you have to learn how to adapt with the person. So that's a challenge, but we've made it work.
Yeah. There's pros and cons, I'm sure.
Yes, yeah.
Just like starting a relationship later in life.
Exactly, yeah.
So you've been together 12 years, married 6.
Yes.
When did you decide you wanted to start a family?
It was about 4 years ago, so about 2 years into our marriage.
Okay.
We were buying a house, and we were like, okay, that's our next step. And we tried for about 6-9 months. I'd been on birth control for 10, 11 years. So, I always thought I would just get off and get pregnant.
Mm-hmm.
But that's not exactly what happened. I got off, and I'd just been off, and we weren't tracking or planning, or I just wasn't on birth control. And I was like, oh, I'll get pregnant.
Mm-hmm.
And then I didn't. And so then we started tracking and planning and doing the things.
Mm-hmm.
And we got pregnant pretty quick after tracking my cycle and doing that.
Mm-hmm.
I went to the doctor.
Did you track your ovulation as well?
Yes.
Okay.
Yes. So I had the Flow app, and then I would get the ovulation and I would confirm it. And then I would do the 2-week wait and take the test right on time and go from there. So it was probably our second cycle of doing all those things. And I got pregnant right away. And we went to the doctor, had a heartbeat. Everything was great and good. And then new mother's intuition. I don't know, but I just knew something was wrong.
Mm-hmm.
And I kept crying every night. I'd call my mom. I would tell my husband, oh my God, there's something, I don't feel good about this. And it was a miscarriage, almost second trimester.
Really?
So,
wow.
Yes. So we had already announced to people, and I went into the doctor thinking I'm 11, almost 12 weeks. I think my appointment was 11 and 4 or something. And there was no heartbeat.
Oh my gosh.
And the baby had stopped growing at almost 9 weeks. So I had lost the baby almost a month ago, and my body just didn't recognize it.
Wow.
So I had to have a DNC surgery.
Okay.
And went through that.
Wow. I'm so sorry.
Thank you. That one was especially being my first pregnancy, that one was very traumatic.
Yeah. I imagine it's not something that you'd ever want to experience with any pregnancy, let alone your first.
Yes, no.
So when you had your intuition, did you have any symptoms that could have possibly highlighted that it was a miscarriage?
Looking back, maybe. I now have a son, so I've gone full term, and symptoms change all the time. So it's hard to say, but yes, I feel like my morning sickness started going away, but I thought I was just entering my second trimester, and that was normal.
Mm-hmm.
But there wasn't huge warning signs. Really, I just felt in my soul, in my gut, something was wrong.
Yeah.
And I couldn't shake it. I would do the Doppler every night. I paid for all these private ultrasounds. I did all these things.
Oh.
Because I was there's something, I just know it.
Yeah.
And everyone around me is so excited and planning a nursery and doing all these things and want to get our, our gender reveal planned and this and that. And I'm like, no, we're not planning it right now.
Wow.
And I don't know why. I think it was a coping mechanism, like my heart trying to protect myself. I don't know, but I was very firm that there was something not right.
Yeah.
And I
It's
couldn't
wild.
get insurance to pay for more ultrasounds. So I was just paying out of pocket to get scans.
Oh, wow.
And then finally, my husband was like, okay, we got to take a break. And then
Yeah.
somewhere after that is when I had, I guess, lost the baby and didn't get to go in sooner. But he was right. We were spending way too much money on all these scans and
Right.
everything looked great. My labs looked great. Like everything on paper looked good.
Wow. I was just going to ask if you were getting your labs done and
Yes.
how that coincided. Did they ever drop?
Yes, they did. So I had stopped. I got probably 4 sets of labs done over like 2 or 3 weeks.
Okay.
And then yes, when we went in, they drew labs again and everything had dropped.
Okay.
So if I had continued through the first trimester getting labs, yeah, they would have caught it.
Yeah. Okay. Wow. Yeah, I'm so sorry that happened so late in your first trimester. I mean, you almost completed your
Hmm.
first trimester, and like you said, I mean, I know you had that intuition that something was wrong, but the fact that your friends and family knew and they were probably getting excited for you,
Hmm.
reaching out about the pregnancy, reaching out about the nursery. Do you have names picked out? Do you have a nursery theme, baby shower theme? All of those things are so triggering when you feel in your heart that it's not right. Something's going on.
Yes, and I'm naturally more of an anxious person. So
Mhm.
my close friends and my mom, they were like, you just need to take a break. You're a new mom. You're just scared. I know it's scary, but I promise you we're going to get through this. And I mean, with the facts they had, they handled it very well,
That's good.
but they just didn't understand this feeling that I had.
Mm-hmm. What year was that? 2022?
This is 2021.
Okay.
And I got pregnant right off of that with my son
Okay.
on complete accident.
Wow. No tracking, no nothing.
Nothing.
Oh,
Didn't even have a cycle in between. It was a complete accident.
wow.
I They had asked me to take, which is also very triggering, and so I really feel like some doctors need to change their protocol, but they had asked me to take pregnancy test until I had gotten my cycle to make sure I didn't retain any tissue, it didn't start becoming positive. Just because my body hadn't recognized I'd lost the pregnancy. I had never bled at all at this point.
Wow.
And I'd had the surgery and I still didn't really bleed. I mean, obviously they take care of most of that for you, but I still didn't really bleed. So they were like, just to be extra safe, either come in for blood draws or I want you to take at home pregnancy test and just like make sure they're going negative.
Mm-hmm.
Well, they had went negative, but I still hadn't had my cycle. So I was still taking them every other day, every 2 days. And I was like, what the heck? There's a line.
Oh
So
my
then
God.
I'm thinking I have to go back to surgery. Like I'm
Oh.
not thinking this. I mean, we had been approved and I was cleared, but we weren't trying.
Mhm.
I guess we weren't really preventing it either, but we weren't trying.
Right.
And sure enough, my HCG was I think like a 15 or something crazy
Oh my
on the
God.
first draw. And
Wow.
then it like just kept going up.
Wow. So how did you feel when you found out that this wasn't your missed miscarriage? This is an actual baby. This is a new pregnancy.
I was terrified of it all happening again. I was scared that my body wasn't going to do the right things,
Mhm.
but I did get blood work this time until my second trimester. I was put on hormones even when I didn't quite need them. I would
Mhm.
be on like the low normal range. And so they would just go ahead, and I was on estrogen, progesterone, all types of things just to make sure we didn't miss anything.
Yeah. Did they have more preventative appointments with you because of your missed miscarriage previously?
Yes and no. I had more, I guess, with like the nurse or the NP, but not necessarily with my doctor, which was a little frustrating. So
Mhm.
like I would go in and she would just like, okay, you're still feeling good. Your labs from this one came back, and would explain and be like, stay on the same medication. I already talked to doctor and I want you to do this. And then would send me on my way with new lab orders. And that would be like in between my actual doctor's visits,
Mhm.
which was helpful, but I wish it could have been with my doctor because it was just always some random lady
Right.
from the, I mean, I think there was 3 or 4 MPs at that clinic. So it was, I never had the same one. I would see one and then maybe like a month later see the other, and
It's just
it
not
didn't
as
feel personal.
personal. Yeah.
Yes, exactly. It just felt like I was a number and they didn't know my story and they didn't know how nervous I was. And they were just like, well, you're fine. Go ahead. And I'm
Mhm.
like, okay, but I'm sweating. Like I'm struggling. So
Yeah. Well, I'm glad that you at least had a couple extra appointments, regardless of not seeing your doctor. When did you feel that you could be excited for this pregnancy?
honestly, my mom laughed at me for so long. I took I had an anterior placenta, so it took a really long time to feel him. I took pregnancy test, I probably till 20, 28 weeks, somewhere in there. Like I was going to the dollar store once a week, buying as many as I could. And she was like, you have to stop peeing on these. Like they're not even accurate anymore. You're so pregnant.
Yeah.
And
Um,
then I learned about this hook effect because then I'm huge and pregnant and I'm getting a negative test. And, when it's too high, it doesn't show up on your test anymore. And I'm freaking out. My mom's like, we have to stop. Okay. You
mhm,
have to stop.
mhm,
But then I could start feeling him a little bit. And it was weird because of the way my placenta was, like the where I would feel him. But once I could start like and seeing him visibly move, then I
mhm.
was like, okay, okay,
Yeah.
I'm gonna be okay. I was a little bit of a nervous wreck. So
Mhm,
I had the Doppler, had all the things. And
mhm,
my mom had been a nurse for 30 years. So she's like, you have to put it here, you have to do this. One of my
mhm.
best friends is a nurse. So between both of them, I think they came over once a week to do the Doppler for me because I was like, am I doing it right? Is this
Yeah. Right. And when you use the Doppler, because I did the Doppler as well on my rainbow baby, and you don't know if it's like gas you're hearing in your stomach
yes.
or if it's the actual heartbeat. I remember whenever we went to the doctor's appointments, I would very intensely see where the doctor is putting the Doppler so that I
Yes.
knew, okay, maybe his head is over here and his heart's right here. But, that sense of worry never goes away.
No, I was just about to say that.
Yeah.
I worried the whole time. It just got a little bit easier.
Yeah. Like you said, once you felt him move, similar to me, that's when I felt more at peace because I knew if I had a sugary drink, I would get him to kick
Yes.
a little bit, and that was my peace right there.
Yes.
And again, like you, I would take pregnancy tests quite a bit, not as far out as you. I probably stopped maybe 15, 16 weeks, but I always wanted to make sure that the line kept getting darker and that
Yes.
it was still dark. Um,
Yes.
and I think those are things that women don't talk about openly, is all of the things that you do in order to bring yourself comfort through.
Yeah, I mean, I'm sure the lady at the dollar store, I mean, she watched me grow She probably was like, what is wrong with this girl? But it was just, it was
Aw.
like this one little piece I felt like I could control because I could see it.
Yeah. Hey, and if that helps, then that's all that matters.
Yes.
So you had your son. When was he born?
January 2022.
Okay.
I was 39 weeks. I had preeclampsia. I had super high blood pressure. You know, we're kind of in this weird COVID world still in 2022, especially right after that Christmas of 21. There was another big like COVID outbreak.
Yes.
And so the hospitals were pretty strict and things like that. So they would not schedule me an induction, either knowing my blood pressure was starting to get high
Okay.
around 37 weeks. They
Okay.
just told me take it easy, like almost bed rest, things like that. Because
Mhm.
if I was resting, my blood pressure was good.
Okay.
So I went on an early maternity leave and I just tried to make it to where we could get an induction.
Mhm.
I woke up one morning, my blood pressure was, I don't remember the exact numbers, but I called my mom and she was like, if you don't get to the hospital right now.
Wow.
And I couldn't really see. I had all the black spots. I mean, like all the typical preeclampsia symptoms.
Mhm.
I went in. They actually were trying to send me home back on bed rest.
Oh my gosh.
And I was like, if you don't, I'm going to another hospital down the street. Like this, I don't feel good. So, you know, and this is just the hospitalist. And this is, you know, I'd been to the ER for my blood pressure probably 2, 3 times by this point.
Mhm.
My mom would come over every day after work and check it because it was getting high. I was like 160 over 95 one day. I was like
Wow.
155 over 110 when I was in the hospital. I mean, it kept getting higher.
Mhm.
And I never would really go anywhere close to normal. I'd stay like 150 over 89, like somewhere in there.
Mhm.
So I finally get admitted. We start Pitocin, my doctor gets there and they take me. I had tested negative for group B strep at 37 weeks. So I didn't think nothing of it. My labs when I get there are good. Like no UTI, no infection. They see on my blood, whatever. I give birth to my son after 48 hours of an induction. My water was broke, I think, 7 hours. It was honestly a pretty easy labor. I had him vaginally. I didn't have any complications. He came out screaming. It was good.
Mhm.
About 12 hours later, it was completely different. My son was lethargic, grunting, not eating. Um, I kept saying, there's something wrong. There's something wrong. It's COVID. My mom can't be there. So I'm FaceTiming her and I'm like, look at this baby. I think he's jaundiced. She's like, he is not jaundiced. I'm like, no, he is. Like, again, I had this feeling I could not shake.
Yeah.
And I'd been on a mag drip for 3 days. My husband's like, you are tired. You are exhausted. Just, he's okay. He's a new baby. You're adjusting to him. He's adjusting to you. And I mean,
Mhm.
he's just repeating what the nurses are telling him. And he's not a doctor or a nurse or in the medical field at all. So he's just relying on everybody else's information.
Yeah.
And I had one nurse who I am still friends with to this day because without her, things would have been very, very different for me and my son. She said, I'm not trying to scare you, but there's something going on. So I'm going to take him to the NICU. And sure enough, she was right. He had group B strep meningitis.
Wow.
So GBS is a transient bacteria, so you can be positive, negative, back and forth.
Mhm.
Well, my test at 37 weeks and then going at 39 was completely inaccurate.
Wow.
So I had a uterine infection from giving birth,
Mhm.
and I started getting a fever and all the things. And then he also was by the time he got into NICU at like 16 hours old, he was sick.
Oh, poor boy.
And we spent 7 weeks there on,
Wow, 7 weeks.
yes.
Wow. And I imagine that was a roller coaster ride, even just leaving the hospital. without him?
Yes, I had yard signs in my yard that said "Welcome home, baby." Sorry, my cat. Hello, ma'am. Um, I had welcome home signs. I called my mom. Well, when he got admitted, again, here with our healthcare system, it was very, the NICU doctor comes in and he's like, are there's any chance you have HIV, herpes, this, that? And I'm like, no, like, no. And he's like, did you have prenatal care? And I'm like, yes, like, can we
Wow.
like calm down? And
Wow.
maybe it wasn't as aggressive as I internalized it, but he definitely was like, there was no like, let me find your chart, let me call your doctor. It was just boom, 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 boom.
Wow.
And
I mean, when you just gave birth, there's all sorts of hormones running through
yes.
us, and coming in and charging in that way is probably not the best bedside manner.
Yeah. Exactly.
I would be a little taken aback by that.
And I had a few instances with him throughout the NICU because we had him for a while,
Yeah.
where, and it was exactly that. Just the bedside manner didn't match what I had needed and what I think any
Mhm.
mom in that situation would have needed. I mean, it was for 3 days, it was very touch and go. I mean, we would leave and I would sit in the car and I'd be like, we're going to go back tomorrow and he's not going to be here. I would wake up to pump because I'm still trying to breastfeed. And I would call the NICU and like, can I get an update? Can you
Mhm.
tell me if he's okay? Something. So then I quickly became friends with some nurses who would update me and call me and try to help me.
Nice. Yeah,
And I felt more at ease when I knew those, because it's COVID, they were very strict about limiting what nurses stayed with what babies to limit exposure.
that makes
So it
sense.
was it was kind of like a plant schedule where they would work so many days and off a couple days, and like we'd have the same rotation of nurses.
Okay, that's great. And especially because you can build that relationship with them.
Yes. So it really did help. Like I knew kind of the schedule of which nurse I would get. And they worked like the same babies in the same areas. So like once he moved to NICU levels, like then we would get a whole new
Mm.
system. But I still could build a relationship and I could like go to the previous nurse and be like, okay, can you please talk to this one? And I know I'm crazy and she's, you just feel like that as a new mom. And
Yeah,
then they would help me build a relationship with the next nurse and we could move from there.
and
So
rightfully so. I mean, you're already going through all these changes as a new mom, but you have a baby in the NICU, and that's a whole different ball game.
yeah, I mean, me and my husband both ended up staying off of work the whole time. So we had to go separate. We were never allowed to be in there together because of COVID. So besides the day I gave birth, for 7 weeks, we never got to see each other be a parent.
That's so sad. I'm so sorry.
And it's a hard transition because feelings I'm feeling and things I'm seeing were way different than the things he saw.
Mhm.
My husband during that time, like, I mean, he is a saint for dealing with everything I asked him to deal with. Visiting hours were like 14 hours long. I would probably sit in there 10 and I would give him 4. And like,
Aw.
I wanted to be there for every round, every test, everything. And I'd be like, sorry, you're going to be in the waiting room. I'll call you when it's done. Like, I wanted to be there.
Mhm.
And then he would make my mom come or one of my best friends come and make me go eat while he would go for a couple hours.
Mhm.
And he never complained. And hindsight, I mean, it was a little harder for him when we first got home to like build the relationship
Right.
because the time was very limited for him. But in
Mhm.
that moment, I needed it. And he just did it and didn't complain. And thank God because I needed it right
Yeah.
then.
Good for him for letting you be able to do that.
I mean, he would drop me off there and he didn't leave. He sat in the waiting room the whole time. I mean, we would spend
Oh,
14 hours there every day. The
that's
nurses knew we'd get breakfast, go get lunch, go get dinner, come back.
mhm.
And we had a couple nurses that would bend the rules for us and do some things after we'd been there. Like I'd never got to give him a bath, and he was like a month old. And so I had a nurse let both of us come back there for an hour to give him a bath.
Aw, that's so sweet.
And I'd never got to nurse him. It was all bottle. He did really well, really quickly. We had a few bad days, but I mean, by day 3 in the NICU, he was not on oxygen, no feeding tube. I mean, it was just IV antibiotics for the rest of the 7 weeks.
Okay.
So the first 3 days, it was a lot. But after that, I mean, he was just there. Like still getting tests, double checking, but he was just there.
Yeah.
And so we didn't get to do anything. So they let him come back for me to try to nurse him because I was just anxious and I just needed support, and I couldn't get him to latch, and I was frustrated. So there was little instances where they would bend rules for us, because it would be like visiting hours there would end at like 11 p.m. or something, and it was like 10:15, and they were like, everybody important is gone. If y'all want to come, y'all come in.
That's very kind of them.
But yeah, the night nurses, I mean, they just had more leniency that they could give, and they tried really hard, especially for the ones where we had been there a long time. I mean, the bed next to us, I mean, I ended up friends with them from the waiting room. They were doing the same thing we were doing. They had been there almost just as long as us, and
yeah,
you just become friends while you wash hands and learn each other.
Bond that you can create when you're in more of a long-term journey like that, whether it's with the couple in the room next door or your primary nurse team, all of it. Especially when
we definitely grew a village from it.
Yeah, yes. I love that word, village. But yeah, I mean, how can you not, when you finally do graduate the NICU and leave the hospital, how can you not continue on with relationships when they were such a big part of an important time of your life?
We still go visit the nurses. I still have a relationship with pretty much all of the nurses he had, and I still see them. They still check on him. His infectious disease doctor that we had was absolutely amazing. Every year on his birthday, I text him an update and a picture. I always send like how he saw him versus now. And
that's so sweet. And I bet that means so much.
Yes, because I mean, he was the miracle of this situation. I mean, there's not a lot of Group B strep babies. It's more common than you think, but they don't typically do well. They don't typically survive, and that was a hard pill to swallow on day 1 when we're in there, and it's like, look, you're either going to have a vegetable child or you're going to probably lose him. Like, this is where we're at. Right. And for him to be the complete opposite, I mean, he's in therapy and we're still doing some things. He's weak on one side from brain damage. He has epilepsy. I mean, there's a few things here, but he goes to Mother's Day out like a normal kid. He plays on the playground like a normal kid. He eats on his own. He's talking, he's walking, like he's doing all the things that they told us he might never get to do.
Yeah.
It took him a little longer. It was a little harder, but we got here.
Yeah, you got here, and it's harder on us parents versus them. Kids are so resilient, and
their brains are so crazy. In this, I've learned a lot, but their brains are so crazy. If the connection isn't made, it doesn't matter. Like, you can make it somewhere else and it doesn't matter. And he is, if you look at him, you wouldn't know necessarily that there's anything wrong.
No, there's definitely not. On the quick time we had before filming this, I told you how adorable he is, and his curly hair is just amazing and unique. But you're right, you would never know that he went through all of that and struggled with some of those things.
Yeah, I mean, we didn't talk until we were 2.5, and I mean, he just turned 3, so talking is still very new for us. But I mean, things were late and delayed, but I I didn't care. I told them this in the NICU, I think 85 times. I don't care at what capacity I brought him home. I was bringing him home.
Yeah. Yep.
He could
That.
have been any which way. I
Mhm.
would have loved him the same no matter what. I was bringing my baby home, and I was set on it.
Yeah.
And
It's amazing
we
the
were,
amount of love that you have
yes,
as a child.
yeah. And I mean, he was going to be it. Honestly, we were done. We were one and done. We went through chaos. We were going to have no more babies, and he was going to be perfect. And that was it
Mm-hmm.
for a long, long time. Like that's where we were.
And he is perfect for you. I say
Yes.
this about my son as well. We've had a medical journey with him, and I wouldn't want him any differently. Uh,
No.
he is perfect for me and my husband, and just the amount of love you have for them is unexplainable. And I know that's so cliche. Everyone says that, but it's true.
It's so true.
There's no love like you have for your baby.
No. And every day I mean, I look at him and I'm like, I cannot believe you can do these things. Like, it
Yeah.
is actually last night we were at dinner, and he was climbing on the playground, and me and my sister looked at each other and we both had tears. And it was like,
Aw.
my nephew is the same age as my son. They're only a few weeks apart. So for a long time, it was really hard not to compare them and to
Yeah.
watch them on the playground together, doing the same things and
Mhm.
taking care of each other. And my son's a lot bigger, her son's smaller. So like my son kind of tries to be like the big bad bully and
Uh-huh.
don't be mean to my cousin. And
Yeah.
hers is like, come here, I'm going to help you climb this. I'm going to pull you up. And
Uh-huh.
watching that dynamic, I mean, we both had tears and we were just like, I cannot believe we made it here.
Yeah. Yeah, you made it. It's the little things that bring the most joy and has the most meaning.
Yes, no, it definitely is.
So you mentioned you thought you were done.
Yes.
Um, do you want to go into your ectopic story?
Yeah, yeah.
Okay, so it was recent.
Yes, it was about a month ago, a little over a month ago.
So did you decide you wanted to expand your family more, or was this a surprise?
A little bit of both.
Okay.
We had gone through some stuff as a family, and me and my sister are very close, and we're raising our boys together. And I just know in my heart I wanted him to have a sibling. Like I just got this. I wanted this,
Mm-hmm.
and me and my husband talked, and he agreed. He was like, we would not have made it through the things recently without your sister wouldn't have made it without you. You wouldn't have made it without her. And he has siblings too. And it was just, we want someday when we're not here, we want him to have somebody.
Mm-hmm.
And even when we are here, like just somebody to go to, you don't always want your parents. And
Mm-hmm.
it was a realization that I hadn't had and I got. So we were, tr- mm, we were planning to start trying and I got pregnant ahead of time.
Okay.
I thought I would have to track and do all the things I did before.
Mm-hmm.
And no, we got off birth control and I got pregnant.
Right away.
No, not right away. I got off birth control in September and I didn't get pregnant until January.
Okay.
But we were planning to get through my son's 3rd birthday in January, and then we were going to start tracking. I just wanted to let my body refresh. I mean, I had been back on it for a couple years.
Right.
And we assumed it was going to be more difficult because it had been in the past. So we were like, if we don't track and we don't plan it, it's probably not going to happen.
Mm-hmm.
It was my son's birthday week. There was a lot going on, and me and my sister are very close and very synced. And she was like, you didn't start your period? And I was like, no. Huh? And I looked, and I'm like 5 days late, and I'm like, this has never happened to me. I've never I always knew I was pregnant on like week 2 of being pregnant. Like this was
Wow.
because I mean, tracking and like the
Right.
first day you could start taking tests, probably earlier than that, I would be taking
Right.
tests. And I just always knew,
6-day early test.
yeah, I just always knew really quick. So I
Yeah.
was like, there's no way. And so I went and, I went to the doctor at 6 weeks. I have a new doctor than I had with my son. I just had to move on from some trauma there. And I have a new doctor, and she knows my family. And she was like, okay, well, you don't have histories of this, that, the other. So we're going to do your 8-week ultrasound. She's like, I'll let you do it at 7 if it makes, but she's like, I want to make sure there's a heartbeat. You have past trauma from that. Like, I don't want you to get there and be too early to not have a heartbeat yet. And so in her head, she was protecting me. And I did like my first little set of labs and everything was good. She put me on progesterone because I was on it with my son and it worked. And
Mhm.
it's one of the hormones that even if you don't quite need, it doesn't hurt you to be on it.
Right.
So she was like, I'm going to go ahead and just put you on it. We're just going to play this safe. I was
Mhm.
like, okay.
So
Um,
when you got your labs done, they were doubling?
yes.
Okay.
So but I only had that first set done. And
Okay.
then she was like, let's just breathe for a minute.
Mhm.
Like, I don't want you watching numbers. I don't want you. I had some pretty bad postpartum with my son, rightfully so, with everything. And she was like, I want you to be as calm as we can be. So she's like, we're not dwelling on numbers. We're not going to do this. I was like, okay, we're not going to do this.
Sounds very much like my doctor too. She
And
she always said to me, "We don't need to do that test because if it comes back negative or with bad numbers, you're just gonna have anxiety over it." And I
yes,
appreciated that. I really did.
I still do. We still want to expand our family at some point, and I still want to move forward with her because she cared a lot about how I was doing mentally. Yes, she cared about me and being pregnant, but she made a point to be very like, I want you in the right headspace, or this isn't going to be a good pregnancy no matter what.
That's so great.
And I'm very grateful for her.
Mhm.
But I'm south of Houston, and she's in, good healthcare in my area is in Houston. So I'm driving 30 minutes to appointments with her, and a lot of appointments because I'm high risk. So she reached out to me, had a nurse call me and said, well, there is an ultrasound place about 10 minutes from your house. Would you rather go to that imaging center? And they're not going to give you results because I'm not there, but they're going to give them to me within 48 hours. And, do you want to do it that way? And she's like, you've been pregnant. You know what the screen kind of looks like. Like, call me right after if you're worried, but you know what to do. Like,
Mhm.
the basic.
Yeah.
And I was like, okay, yeah, you're right. My son has an appointment. I'm helping my sister. This week is crazy schedules. That would actually be perfect. And she's like, okay, it's completely up to you. If you want to drive to me, we'll do it. I'm like, no, you're right. So I go. It is the worst experience of my life.
Oh,
They
no.
tell me my husband cannot come in the room. They um, tell me I can't see the screen. They take my phone. They tell me I can't know anything until the doctor calls. I'm
Really?
like, yes, like very, very awful. And my doctor had used this place one other time for a different patient. And she afterwards told me it was similar, but it was like 3 years prior. And she just hoped things had changed.
Mhm.
And she had never sent anybody else there. And now she won't send anybody else there. And so I called in a panic because I'm like, I feel like something's wrong. And she's like, well, we're going to hold on to the fact that if something's wrong, they typically call me pretty quick.
Mhm.
And I had an afternoon appointment. So this is like the following morning. And she's like, I didn't have an urgent voicemail. She's like, when I faxed your thing over, it had my cell number on there for an emergency. Like, we're going to hold on to the fact that they haven't read it yet
Mhm.
because everything looks good. She's like, I know you wanted a picture, and I promise as soon as I get them, I will email them straight to you. Like, but normally these places call me if there's something not right. So we're going to hold on to that. And you're going to go again in 10 days, but to me, and we're going to see how it's grown. And we're going to, we're going to do all the things. And I was like, okay, you're right. You're right. And she's like, you're not bleeding. You're not having pain, nothing. Like we are good. I'm like, you're right. We're good. So leave it alone. We're at the 3-day mark. They still have not called with my results. My doctor's been calling every day, calling and checking on me. It is like nobody has called. So finally, she's like, okay, it hasn't been quite as long as I wanted you to be, but I want, like, we're just, like, I'm fed up. Like, she called and got me a refund from the other place, like, because she was like, this is ridiculous. Like, you should have results. This isn't how we're going to do this. So then I go,
Gosh, what was going on?
I guess they're just backlogged. I really don't know, because
Wow.
after 3 weeks later, after I've had surgery, they finally call me and give me my ectopic results.
No way.
Yes.
3 weeks
3 weeks.
Your surgery.
Well, it was 3 weeks after the first scan.
Right. But
after
you already had surgery.
Yes.
Oh my gosh.
So I go, and the place that she does her scans with is across the hall from her. So, it's like perfect. And I get in there and it's totally different. There is like a couch that could fit 25 people if you wanted to have them all in there. Like it is projected on the wall. You get to see it all. They don't care. She's like, I can't explain it. I'm not a doctor, but I can say that's a baby, that's a heartbeat, this is your uterus. Like, she's like, I can just give you basic anatomy. I was like, okay, that's fine. And she scans me for about 10 minutes and it is silent. And me and my sister are looking at each other. And every time they go past my uterus, I like this like pit just, and I'd be like, maybe that's not my uterus. I mean, I can't read an ultrasound. So I'm like, that's not it. And then like a pit, and it just kept going and going. And she goes, I'm going to be right back. Please don't move. I was like, I've done this before. Like, I've done this before. So I look over to my sister. My husband couldn't get off work. He has a new job. So, and he's like, I want to use my sick days and my vacation days for the like anatomy scans and the big ones and if you're okay with it. And I was, so my sister went with me. I look over at her and she's got tears and we both we know. But I thought they were about to come tell me like it was another miscarriage, or you must have had a chemical pregnancy and the progesterone had just held everything together because, your uterus is clear, like something like that. So she comes back in with my doctor on the phone and they're like, you need to get to the hospital right now. And she's like, how are you not having pain? And I was like, I don't know. Like, what do you mean? Like, I'm still thinking they're about to come tell me that I'm going to need a DNC. Like that was not on my brain at all. And we actually had joked about it during the weeks when the doctor and the nurse would call. She'd be like, well, it's, if it was ectopic, they would have called. If it was ectopic, they would have called. So I was like, okay, so that was not my thought process.
Wow. I feel like a common denominator with all the stories I've heard regarding ultrasounds and getting the ectopic diagnosis, it's always the whoever the tech, the ultrasound tech. Yes. I don't know how to say the medical term. They always say, hold on, I need to go speak to someone, or, they leave the room. And, I feel like that's not a good best practice because that automatically gives you that panic feeling.
Yes. This poor girl, I mean, when she came back in and my doctor had hung up the phone, she was actually at the hospital. So her office is across the hall. So she told me normally they would have came and grabbed me and I would have came in the room. She's like, but I'm about to walk into a C-section at the hospital. She's like, so I need you to meet me at the hospital and get here. And we hang up. And I mean, this girl is white and she is crying and she is, I am so sorry. I did not want to tell you this. And I mean,
Oh,
she is so sweet. Like, there is not a, yes, they need a better protocol and practice in general, but this girl looked like she was like, this was not, she could not handle having to do this.
oh wow.
And she, I mean, she typed everything out for me on my phone. Like, when you go to the ER, if she's still doing what she's doing, it is your right tube. It is about to rupture. It is this big. It is like, I mean, details. Your pregnancy sac is this millimeter by this millimeter. I mean, like,
Wow.
she's like, here is a disc. Take this, tell them to look at it. Like, she was,
Wow. That's amazing.
she was great and
Yeah.
very sweet. And she hugged me and she hugged my sister. And so I'm a daughter of a nurse, so I'm a bad patient. Me and my sister have our kids at the same Mother's Day out, and my older sister is out of town during this debacle. And I'm like, okay, well, I'm gonna take you home. I'm gonna get sweatpants and a charger. I'm dressed for work, so I'm like, I need a makeup wipe. I can't like,
Yeah.
I have nice clothes on. Like, no, I'm a hairdresser, so I was like dressed up, and I was like, I'm not going to the hospital like this.
Hmm.
So I drive home from almost Houston, so a good 25-30 minutes. I'm told to go straight to the hospital. So like I said, I know I'm a bad patient. And I get sweats. I call my husband in a panic. He leaves work. He meets me at the house. Actually, he gets to the house before I do. So he's already packed a bag, has makeup wipes in his hand, and he's like, get in the car. You're changing in the car. And my sister goes to handle all the kids. And me and him haul butt to the hospital.
Hmm.
Get there. My doctor's already called and told them I'm coming. I mean, I don't even sit down. I check in. They check my blood pressure. My blood pressure is very low. They're like, it's time to go.
Wow.
So we go into a room. They scan me abdominally in the hallway because my blood pressure is low. They're like just trying to make sure I haven't fully ruptured right there.
Hmm.
And I was starting to. They could start seeing some blood in my abdomen. Because at first they're like, my doctor's like, you're going to get the shot and we're going to do it this way and we're going to save both your tubes and we're going to do this. And I get to the hospital and it was very quickly, it was like, that's not an option for you.
It's
And
too
the way
late.
and the way my schedule is I don't know that I could have done the protocol of the shot correctly anyway. Like, schedules with my son and my nephew, life is too crazy for that.
Hmm.
So I think for me, I would have wanted surgery no matter what. I also just needed it to be done. I didn't want to have to do the labs. Like, there was just a lot of variables there that I didn't want to do.
Hmm.
And so, but it being made for me was easier. Like, okay, but you have to go have surgery.
Yeah.
And
It's hard when you're given the choice between methotrexate or surgery because
yes.
you don't know the pros and cons to both. And I mean, you can do a quick Google search and you can get a quick rundown from the doctor, but there are lasting effects with both of them
Oh, yes, for
that you have
sure.
no idea about.
No, and I was in that moment, I have a 3-year-old at home who needs me. I have a 23-year-old sister and her 3-year-old that I am also responsible for. I mean, our parents are passed now. So like I take care of her. And I'm like, I don't have time for any more
Hmm.
extra steps. And they were great in the ER for the first 5 minutes when we thought I had a choice. But then they learned very quickly I did not have a choice. And I think I checked in at 4 or 5 and I went to surgery by 10:30 that night.
Wow. That was really quick. And so when you finally did get to surgery, did it fully rupture or did it
Yes.
still? Okay. Wow.
I had fully, so now I know. I had shoulder pain that day before.
Hmm.
Like I said, I'm a hairdresser. My back hurts randomly. I thought I had pulled something. I had done too much. I had worked a really long week those couple of days before. Like, that was just not, my shoulder hurts all the time.
Mhm.
So I
Yeah.
just didn't think anything of it. I didn't have pain in my stomach. I was not bleeding at all. Um, my
Did
tests
they
were getting darker. I was still
Mhm.
testing at home. They're getting darker.
Did they say why shoulder pain is involved with a rupture? I've always
No.
wondered that and haven't actually researched it myself. I never received shoulder pain. I got methotrexate. I didn't have a rupture, so maybe that's why, but I've always been curious as to why shoulder pain is involved.
Yeah, I mean, it was like, and it's, for me, it was my opposite shoulder. So I lost my right tube. It was my left shoulder. And it hurt like, they call it shoulder tip pain, but
Mhm.
it hurts like more in the front. Like, it's just a very weird, like, but the way I'm always this way, I just thought I'd stretch something. It was
Yeah,
not unbearable. It was just like you had, for me at least, it was like you slept wrong, like that kind of pain. Like, oh, this is uncomfortable, like
right.
that.
I'm going
Not,
to research that after our call because I am curious. I want to figure that out.
it's just, it's crazy. And
Yeah.
since my son have been battling here and there some high blood pressure due to, residual.
Mhm.
And so when I went in and my blood pressure's low, I mean, all of their faces drop. And I also don't realize in that moment that that's a sign of this going the wrong way and you bleeding. And I'm
Mhm.
like, oh, I even made a joke. I looked over to my husband and I said, my blood pressure is really good. It's like 110/72. And he was like, and then because he could see behind me all of their faces.
Mhm.
And he was like, and I'm like, what? It's good. And I
Yeah.
mean, I'm in like la la land.
Mhm. That's such a good way to put it is La La Land. You're almost like so out of it and shocked that you're very, I don't know, like loosey goosey and just ready to go after whatever I'm about to go through.
Yes. And I mean, they tell me I'm having surgery, and I mean, we have to go quick. I'm sure the protocols are different if you're not where I was, but at least I hope, because I didn't even realize what kind of surgery I was having. Like, I mean, I knew I was having surgery, but like, we didn't talk about how we were gonna cut me. Like, it was just, do you consent to this surgery to save your life?
Mhm.
Yes. Like, I wake up and I'm like, my stomach is 9 months pregnant and I have all these incisions, my belly button's tore up. I'm like, what the heck happened to me? And like, it's just, there's no time to go over things like that. It's I was awake going into the OR. Like, they didn't get to give me anything before we went in. I got my IV in the OR. Like, it was, they were trying to make it as calm as possible while we were in there, but I mean, we get home and my husband's like, the room next to us had somebody that got hit by a car, and I heard them say you were going first. Like, I knew
Yeah.
there's a
There's no
level of
time.
trauma there.
Yeah. There's no time to figure out the right questions to ask because,
No.
again, you're shocked. You don't understand what's going on. You hear that your life is threatened. And it's almost like, again, it's an out of body experience, similar to what we were just talking about, but you don't have time to logically think of the right questions to ask. I'm sure you probably asked, well, am I going home tonight? Or how long's
Yeah.
the surgery?
Yeah.
But you don't ask, where's the incision going to take place? How big is the incision? How big is the incision going to be? Are
Right.
there multiple? What's the recovery
Yeah. They
like?
said laparoscopic. I'm like, oh, cool. Like, and,
Yeah.
and then now, right mind, I'm like, well, yes, obviously that meant that this is what it was going to look like. But in that moment, I was just like, okay. I mean,
Yeah.
and they're having me sign for 6 different maybe surgeries. I mean, they had me sign to do a full hysterectomy just in case it had ruptured to that point.
Oh my
They
God.
had me just to take my right tube and ovary, to take both tubes. I mean, like every combination of that, I had to sign all of those. And so then it's like me and my husband are staring at each other like, am I going to come out of this sterile and like we can't have kids, or
Right.
like where are we going to be?
Mm-hmm.
And I'm very grateful. I did lose my right tube. They said if they would have saved it, I would have had too much scar tissue and I would have more than likely had another ectopic.
Mm-hmm.
But I still have my right ovary, and so my
That's
fertility chances don't really go down because I kept both ovaries. So
right. And your other tube can easily move back and forth.
yes, which is crazy. I just learned that.
Yeah, it is
I was
crazy.
like, okay, so my fertility's in half. And they were like, oh no, it's
Mhm.
not connected to anything. It just kind of like goes over. I was like, our bodies are crazy.
I know. They're crazy. Like, how does it know to
Do
move
that.
back and forth like that? Yeah. Yeah. Our bodies are amazing and warriors.
Another part of this that I feel like people don't realize, and I am grateful for my doctor in this, was you still were pregnant, you still go through postpartum. And it was very, I mean, I'm having postpartum hair loss. Like there's things that I'm having that I've talked to my doctor about. And I had been medicated from my son, and I had still been medicated because hospitals and medical things are a big trigger from my anxiety from my son. And so I've stayed on it. And she, reevaluated me when I went, and it was just not something like me. It didn't click. Like I was like, my hair's falling out. I'm not, and I'm angry. And she was like, okay, well, we might need to adjust you because you're going through postpartum. And it was like this light bulb went off. Like, you didn't get to bring a baby home. I wasn't that pregnant. Like all these things. So you just don't think you're going to have that, but
Mhm.
you do.
I appreciate you sharing that because I think that's one of the things that most people who don't experience pregnancy loss don't understand is you still had all of the pregnancy hormones.
Yeah.
So they went up when you were pregnant. And even though you lost the baby, they're still there and slowly going back down. And we do experience all those things. I, like you, had to get reevaluated, and I was in a pretty deep depression postpartum after my ectopic. And yeah, it is hard to talk about and hard to admit, but it's so common. And I
Very,
wish
very common.
people spoke about that more.
Me too. I and even for me, like I probably won't ever be able to get off of everything. I mean, I hope so, but realistically, that's a conversation me and my doctor have had. Like, there's just too much trauma, and I think you're like, oh well, you had that postpartum, so like you should be good. Your kid's 3. It doesn't work like that. That's not like your brain completely rewires, and you don't you just don't bounce back from that like the world expects you to.
Mm-hmm.
Everything about you changes.
Everything. Yeah. I often say that so many people think your life just moves on like everyone
Mhm.
else's life. But for so long, you live in the past and don't look at life ahead of you.
Mhm.
Um, and it has to do with the grief that you go through. And um, it's just so difficult.
This experience was easier for me to go through than my missed miscarriage, but I think it was just very different. the excitement was there. And not that I wasn't excited, but it wasn't real yet, I guess. And being so distracted, already being a mom and being a second time mom and those things, I really feel like factored. But I feel like for my friends and family, this was a lot harder for them,
Mhm.
because I don't think I still have grasped the whole like how bad this could have been for me.
Mhm.
Where my friends and family are like, no, like that very quickly could have been a very different story.
Yeah. Very
Yeah.
quickly.
And they have struggled a lot more
Mhm.
with that side. It's definitely starting to hit more, and the severity of it and all those things, and watching my sister get so emotional, and my husband and his mom, and just watching like, okay, what would we have done if, like, those kind of conversations. But you don't necessarily think, like, for me, I just went into straight, well, I'm still a mom, I don't have any other choice. Like, I don't know how I could have went through something like this and not have had my kid to come home to, because
Mhm.
it definitely, like, I went straight into that. Like, I still have to be a mom.
Yeah, definitely. That probably helped distract you a little bit
Yes.
too. I used work as a distraction. I went to work the next day after treatment, and maybe that's why it took me a few months for the realization to hit. But, you know, I can tell how strong you are just by the way you're describing everything, and the fact that this happened a month or so ago. I can't believe it.
Yeah.
I really cannot believe it because you just seem so strong.
I I feel like my whole life is like this poster for like what you could go through, and I think it took me a really long time not to be the victim in that and like dwell. I mean, everybody has their things, and just because my things are large, it I can't just live in that, and it's taken me a long time to be okay with that and understand that. But I've watched people I love, when we've gone through the same things, really dwell in it. And I've watched their kids suffer, and I was the kid that suffered. I watched my mom go through some things, and I just don't want that for my kid. And so I feel like that's where I've just had to find it and funnel it and make it okay, because I want so much more for him.
Yeah. Yeah. That's that's a great way to look at it. A really great way. And your story is going to help so many women.
I just I actually had somebody reach out to me yesterday or 2 days ago on Messenger and was like, "What are your symptoms? What were your symptoms? Did you have any? What should I ask for?" And it's crazy because right after everything with my son, I had people do the same thing with group B strep, and I had friends that were having babies, and I was like, "Just get freaking antibiotics. I don't care. Like, just get
Yeah.
them."
Yeah.
And
And that's the power of sharing your story openly through your personal social channels or even in person, because you have no idea how much being vulnerable like that can help others. I don't speak too much about my ectopic on my personal social media accounts, but I did the year that I had my ectopic. I shared my story mainly for awareness purposes.
yeah,
And following that, and even till this day, I'll have people that I knew in high school reach out to me and ask about my ectopic symptoms, just knowing that they saw that I shared my diagnosis prior. And like I said, that's the power of being vulnerable, is you can potentially help others.
yes, I 100% agree. And for they never know why this happens, but for me, it's they think because I had that uterine infection, that I have scar tissue. And I mean, there's no way to know for sure, but just knowing things like that and being able to tell people, I mean, I never would have thought after everything I'd gone through with my son that it could be something else that could happen.
Right. It's so hard not to blame yourself or a past situation or, all of the things. The unknown is really hard.
Yes, it is.
Well, thank you so much,
Thank
Sydney, for
you.
taking the time to share your story and be courageous. Is there anything else you want to share?
I'm just keep, it's hard. No matter what kind of pregnancy loss, it's hard and
Mm-hmm.
it's going to be hard, but you have to feel it and you have to channel it into something, and you have to find something that makes it this much okay,
Mm-hmm. Yeah,
because it's never okay.
right.
Hello,
And
ma'am.
it's okay not to be okay.
Yes, it is. And it's okay to have the feelings and
Mm-hmm.
have a bad day. And it's okay to have a good day too. I feel like I felt guilty a long time for having good days.
Mm-hmm. Yeah. And there will always be good days and bad days.
Yeah. And it's lasting from the first one. I already know I'm going to have, it's not going to just be over.
Mm-hmm.
And the world expects it to be over, and it's okay that it's not over for you.
Definitely. Yeah. Well, I'll keep you and your family in my thoughts and
Thank you.
hopeful that you'll have your rainbow baby.
Thank you.
Yeah. Thank you so much.